global priority. This will be an opportunity for people with mental health conditions, advocates, governments, employers, employees, and other stakeholders to come together and recognize progress in the field and to be vocal about what we need to do to ensure mental health and well-being become a global priority for all. To discuss this plus more, we have with us in studio our dynamic studio guest that will take us through this all-important presentation. Why do we celebrate October 10th as World Mental Health Day? Why is this year theme focusing on making mental health a priority? Our panel is comprises of Mr. Benjamin Bala, Secretary General from the Cultivation for Users Hope. Next to him is Mr. Tama Yonka, Program Manager at Action Against Hunger. And next to him is our beautiful lady in studio, Madam Leona. Sorry, you will call your name because I didn't include it in the presentation. So we're going to start basically with Mr. Benjamin Tama Yankwan, right?
Joseph
Tama Yankwan.
Yeah.
So we're going to start with you. Can you just tell all the fundamental or the basis, or just tell her about World Mental Health Day and why make this day relevant globally?
Well, okay. Thank you very much. Like I said, my name is Joseph Nyoko. Thank you so much for the opportunity. My name is Joseph Nyoko. I serve as a mental health, psychosocial, and protection program manager with the Action Against Hunger Liberia mission. Before getting to the relevance of this day, I will firstly like to raise a little awareness on what mental health is and what mental illness is. Most time we think that mental health is just mental disorder. But if you look at the definition of mental health, it's not just the absence of mental disorder, but it actually the state of well-being that has to do with individuals realizing their full potential and then able to cope with daily or normal life stresses. And if you look at mental illness, these are health conditions that interferes into our emotion, in our ability to think, and our behavior pattern. So that being said, it means that it's very important. We experience these issues on a daily basis, and this is why we as a mental health or psychosocial support service provider, we do not lead the process. I mean, our own intervention is a helping relationship, because we believe that the counselor, the counselee or the victim survivors has the potential, but because there's some level of interference, so those potential has been gone away. So the issue is that we try to provide the necessary support in a guiding relationship so that the survivors regain their potential and then also have the ability to solving their own problems. So we do not solve our own problem, right?
Okay, so why make it relevant globally, not just Liberia, because worldwide they are celebrating this day?
So if you look at the theme, make mental health and well-being for all a global priority, you understand that this is a core action. And it is now that the fact that mental health is not given much attention globally, even at the level of Liberia. This is a core action that all of us as actors, be implementing partners at the government level, we should all combine forces. This is why we are here in studio creating the awareness so that we prioritize mental health interventions and we prioritize mental health activities, and then we attach value. So that's the rationale behind coming to the studio and commemorating this World Mental Health Day today.
Okay, thank you ever so much, Mr. Bala. Let us come back to you. This year theme, World Mental Health Day, is making mental health and well-being for all a global priority. Is mental health a priority in Liberia?
Here in Liberia, I would say, I don't know whether the mic is on.
It's on.
All right.
Live.
Mental health is not a priority in Liberia.
Why?
I am a survivor. I am a consumer of mental health services.
Okay.
Cultivation for Users Hope is the only Liberian organization that is run by service users themselves. I mean, when I mean service users, I mean we are live experienced people. We suffer mental illness ourselves, recover, and are living in well-being. So we are there to advocate. And in our advocacy, since 2010, we have now seen that mental health has not been prioritized by our own people in Liberia, including the government of Liberia. So I would say no, mental health is not a priority, which is sad. It's a sad thing in Liberia because we all need mental health. Without mental health, there will not be no good functioning of our various ministries and all of that. So we need good mental health. So this year theme is so much important that we have to make mental health a global priority. And this day is set aside, October 10 is set aside to raise awareness. The day is to set awareness, raise awareness, mobilize efforts to support mental health issues. Those are affected with psychosocial disabilities, to support them in their quest for a good mental health.
Okay, and I'll come back to you, Mr. Mistress, Madam Leona, representing Qatar personally, in terms of being part of the steering committees, because I know that all the other organizations join Qatar to carry on this awareness. In terms of being part of the steering committees on this year Mental Health Awareness Day, give us some context as to why Qatar needed to form, to gather other organizations to form part of this in the first place, and what was happening in Liberia that you people saw a need really concerning in that area when it comes to mental health.
All right, so I want to say thank you very much. As you rightly said, my name is Leona Carlos Soare, and I work for the Carter Center, where we fight diseases, we wage peace, and then we build hope. So in terms of fighting diseases, the Carter Center has a mental health program that has been put in place and have been operating in the country since 2010 to present. So if you come to the reason why we should mobilize or put our efforts together with other institutions to make sure that we promote mental health, and even form a part of the actions from the Federation of Mental Health to make sure that mental health is being promoted. We, as you heard Mr. Bala rightly saying from his own quote-unquote analysis that he thinks Liberia is not giving priorities. Okay, we agree. In the midst of many challenges, we at the Carter Center feels that, or know that the government is prioritizing mental health, because our effort along with the Ministry of Health, the Ministry of Education, Ministry of Gender, Children and Social Protection, we have developed the mental health policy that is being implemented. So for the past, from 2016 to 2021, this policy was implemented, though not fully achieved yet, but we believe we're on the path. And so to also raise awareness among the commoners, among the partners, government officials, we feel we need to come together this October, that we are now celebrating the World Mental Health Day. It starts from the 1st to the 10th. So Carter Center alone cannot do it. We need the efforts of our partners to be able, I use the word buttress most of the time, because the World Federation for Mental Health is recognizing the 10th of October as a day set aside to celebrate World Mental Health Day. So we also, as a part of this committee, have come together to call on action against hunger, call on MSF, call on the government of Liberia, call on Ministry of Health, Ministry of Education, all over the country, that we can galvanize our efforts to make sure that we raise awareness on mental health, mental illnesses, making sure that we fight against stigma. And the 1K work that you will talk about later on will be like a big awareness campaign.
So let me just hold you there. You talk about raising awareness. What was some of the issues that were taking place in Liberia when it comes to mental health and well-being, and how did you people start to address this issue?
Okay, so like I said, for my brother who worked for Cultivator for Users Hope, initially Liberians, some of us, let me just use quote-unquote, some of us had a perception that when you have mental illnesses, it's as a result of a curse. So that means they have to seek help only from maybe fetish priests, from the churches, and from other places. We're not going to erase that. in as much as we respect the culture and beliefs of people, we also think that we can a little bit shift our perception from just believing that mental illness is just as a result of being cursed. Mental illness is as important to be given attention as you have cancer.
Right.
I was just discussing with my colleagues the other day. People pay attention to their parents or their children or their family members when they have cancer, when they have HIV and AIDS, when they have diabetes, you know. So why isn't it that we can put that same attention and priority to people suffering from mental illnesses? So that was not happening in the past. So now that we saw that people have been using perception in the others, different ways people think it ugly, so now we thought that it's about time that we educate the public. For example, in our school-based programs, we train mental health clinicians, child adolescents mental health clinicians, to be able to identify mental health conditions such as depression, anxiety, epilepsy, so that you can be able to support your students. So those things were not happening in the past. That's what we saw and decided to pay more attention and join other partners in raising awareness.
Definitely.
We train mental health clinicians all over the 15 counties of Liberia. We now have clinicians, and we're fighting to make sure they have good sustained credentials and have training institutions that will continue with this training even when Carter Center shall have left the floor.
Definitely, indeed, mental health is every one of us business, and one way or the other, one way of the other, we shall come down with this condition. So it's everybody business. Everybody needs to hold hands in tight to make sure that we make this a global priority, especially in Liberia. Thank you ever so much. If you're on our break this morning, the numbers to call and be part of this all-important program is 777-0107, 0886-107-107. So you can start placing your call in. The phone lines are open, so you can keep your call coming in. But before we accept call, let us come by to Mr. Yanka. Mr. Yanka, what are partners doing to mitigate the gap in mental health services in Liberia?
So thank you very much again for the opportunity. Like I said in my previous statement, that this is a collective effort, this is a joint effort, and partners are collaborating with the government, right? And then the fact that we are collaborating with the government, we try to complement government effort in everything we do. So most of our program and project design are tailored to international standards as well as national strategies and policy. So what we try to do, especially for Action Against Hunger, we are trying to mainstream to integrate mental health, psychosocial support, and protection in all of our ongoing projects, including new project design. So currently, taking into consideration the mental health policy and strategy, we have identified several gaps, and then we try to address these gaps. So what we are doing, we are liaising with the mental health unit. We are also working with the Montserrat County Health Team in terms of providing training to community health volunteers. We realize that that's another gap where individuals actually need enough information on mental health services and psychosocial support.
So how long is training been going?
So we have implemented trainings in the past, and then like I said, new project design, we have incorporated a lot of pieces of activities that will be supporting both the mental health unit as well as the Montserrat County Health Team. We are also having engagement with the School Health Club, and that is done through the Ministry of Education, through the School Health Division. We, like I said, we are not inventing anything new. So we work with existing structures. We work along with systems that have already been set up and developed by the government, and then we implement these activities.
Is this program open to Monrovia or Republic of Liberia in 15 or 16 countries?
Currently, the project we are concentrated in both urban Montserrat and rural Montserrat.
Okay.
Yeah, definitely. So that's the coverage for now. But these are things we are doing. We also engage in community structures. We are having activities with moral support group, and those activities at the community structure is being implemented by one of our local partners, the Community Healthcare Initiative, engaging moral support group. And this year we want to pilot what we call father support group, because from the learnings from the previous implementation, we realized that engaging moral support group definitely you have to also engage father support group, because the fathers also support the mother in as much we try to develop and build support women capacity. So these are a couple of activities we are doing currently. Action Against Hunger is currently involved into the different sectors. We are in food security livelihood. We are in the WASH component. We are in health and nutrition. We are in mental health, psychosocial and protection. And lastly, we are in advocacy. So these are the things we are doing currently.
That's a very brilliant job. Indeed, Action Against Hunger is really working in Liberia. Let us come back to Mr. Benjamin Bala. Mr. Bala, you say you are, let's say, you serve as an example, pre-example for yourself when it comes to mental health issues, especially in Liberia. You got experience, right?
Yeah.
What can we say to people who are worried about accessing mental health support due to stigma and stereotypes, since you've been through this experience?
What I can say to people who are worrying about mental health issues, stigma, you see, stigma is a big disease that we still fighting, but we working along with partners, the Carter Center, MSF, Action Against Hunger, and other partners, or partners in health. We all working in Liberia to make sure that we reduce stigma to a certain extent. That's what we suffer for us as live experienced people. You know, people have the perception that once you, like Cynthia was saying, once you have mental illness, you are doomed. In Liberia, we refer to them as crazy, your wire pal, and your bull losing, all kinds of names they give them. But it's not so. For me, I took up the courage with the help of Cap Animal at the time, Grand Hospital. So we took treatment, and mental illness is like Diona was saying, it's like any other sickness. Why will Liberia pay attention to polio and other things? They will bring medication, but there's no medication available for people with psychosocial disability. Only for Monserrato. Right now, all around the counties, there are medication issues. Only for Monserrato. Monserrato is not only Liberia. People in the southeast, people in Lofa and other places, they are relapsing everywhere because of medication issues. So this is why you asked me, is mental health a priority in Liberia? I said no. We are fighting to make mental health, to raise awareness. The 1K war. There are a lot of people don't know about mental health. A lot of people don't know about mental illness. They believe that people have mental illness, they are doomed. But for some of us, we took our courage. We listen to clinicians' advice, like the Carter Center have trained over 360 some more clinicians in this country, and they were able to help some of us. We took treatment. We were able to graduate from the University of Liberia. Today, we are working as a classroom teacher, and so we serve as a great example to anyone out there listening to us. Would say, but if this guy took up clothes in the street, and today he's there teaching, he's a school teacher. At the same time, he worked for the cultivation for users of, I believe I myself can be well. So this is why October 10th is set aside. The day was first celebrated in the year 1992 by the World Federation of Mental Health. So we try to just to raise awareness. This day we raise awareness, like this year, it's marked with 1K war. Sure. We're going to do wire dance, make sure that we allow people in Liberia don't even know about mental health. And this group we're talking about cultivation for user hope, we were able 2019 to raise awareness to the parliament. We presented a petition to them and make them to have budget for mental health in this country. All along our fiscal year, our budget year for this country never had mental health in it. But because we talked to the capital and then we presented a petition, they were able to put 25,000 in the budget for fiscal year 2019-2020. That was very little for mental health.
Wow.
A country of about 5 million population, 25,000. That's a mockery to mental health. So this is why I say mental health is not a priority in Liberia.
All right, thank you so much. Let me just so you just on our first this morning. If you on our first this morning, you want to be part of this all important program, you call our Hot FM number 0770-107-086-107-107. If you're outside Liberia, you want to be part of this all important program, you can call our Hot FM WhatsApp number +231-880571-223. That's our Hot FM WhatsApp number, so you can keep your calls coming in. And ask our studio guests all of the questions you want to know about what mental health day awareness. What are some of the things you are expecting from the organization to carry out in Liberia? Is mental health a priority in Liberia? What's your input? So keep your calls coming in and ask our studio guests all of these questions you want to know about mental health Let us come back to you, Ms. Soiree. Yeah, we talking. Yeah, you were coming. We're talking about mental health. But when it comes to mental health treatment disorder, especially in Liberia, it seems to be as expensive by a lot of people. How can we get that shifted into primary health care and to at least make it less expensive in Liberia?
So that is why I'm grateful that we have Cultivator for Users Hope that is being incubated. Let's say the Cattle Center is the one nurturing, because they now work with in partnership with Cattle Center. So Cattle Center is working with the Cultivator for Users Hope to make sure to raise awareness, one, to also ensure that government, as we work with our land ministries, able to provide allotment in the government's budget for mental health, drugs, mental health programs, because like I told you, all of these NGOs we have here today will leave. It will be left with our country. So even if Cattle Center bring millions of dollars and say for mental health programs, how sustainable would that be? So working with the government to ensure that we have our primary health care strengthened. We train clinicians, like you rightly heard, we've trained over 300 plus clinicians that are in the 15 counties of Liberia. We are working with the government to strengthen their health system. Liberians will suffer a lot of traumatic events, depression, anxiety, like I named.
Suicide.
We just heard of a girl who committed suicide in the Crossway 2 days ago. And people will say, but that's small thing in our Liberian time. That's small thing we ought to kill ourselves. What you may tell small may not be small for another person. So in as much as we're talking about drugs, we're also talking about programs that will be put in place. That is why Cattle Center is working with the Ministry of Education, working with the Ministry of Health, working with Gender, Ministry of Justice, to make sure to flag mental health issues so that we can be able to make allotment in the government, budget for mental health drugs, mental health programs. So if you see, we have the mental health policy that was drafted, let's say 2009 with recommendations, and then they put in place from 2016 to 2001. Now that mental health policy have elapsed, what we are doing is to put partners together, like you heard him talking about implementing the mental health policy, that the government will help to make sure that this policy is implemented by partners. When you go to implement the full things that are enshrined in our mental health policy, our country will be at a level that we can say now 100%, at least 80 to 60% of our mental health issues will be addressed. So all we need to do to strengthen the mental health, getting drugs, making sure programs are in place, is to implement the policy, the National Mental Health Policy and Strategic Plan of the Ministry of Health.
In Liberia.
In Liberia, yeah. So we can tell you come for drugs. We have the Grand Hospital where you got drugs from. And let me quickly put this in. I will always say, people with mental illnesses, whether we take care of them to contribute to the society or not, they will still consume the economy, let's say the things or the products that we have in the country. So it's best for the country to invest into mental health, to make sure that our people suffering with mental illnesses will come to their well-being. Like you said, health is not just the absence of disease, but it takes in consideration the entire body, both the body, the mind, the behavior. That's what we call to be mentally healthy, to be able to cope with the day-to-day stresses of life. So we need to contribute to mental health, to make sure that these people who are suffering with mental illnesses will also form part of the production of the country. Economically, it would boost the country's economy.
All right, thank you ever so much. Let me hold you there. I'll come to Mr. Yanko. Mr. Bala just said that 2019-2020 passed a bill for mental health, and we all know during this period we're in an era called pandemic, right? What have you noticed in Liberia? How COVID-19 has affected the mental health of the population of our country?
Thank you so much. This is very interesting. And in fact, the fact that you made reference to COVID-19, I just want to recite a statement from the United Nations Secretary General in 2021 during the COVID-19. And I quote, he said, in 2019, UN Secretary General said that without determined action, the impact of COVID-19 on mental health may last far longer than the pandemic itself. Can you imagine that? So the UN Secretary General recognized this, that we need collective action. We need determined action. If I would tell you, maybe we just try to emphasize right now on the COVID-19 effects of the COVID-19 pandemic, but let's go as far as the 14 years civil conflict that affected. I can assure you that there are people, there are individuals who still suffer the effect of the 14 years conflict. So sometimes the recovery processes are different based on individual level, right? So people recover. Sometimes when a traumatic situation happens, it depends on the attachment of the individual to the loss or the interpretation of the loss. So I give you a practical example. Two scenarios. If you have a child, a father who gave birth to a son and then did not take care of the son, he abandoned, neglected the child with the mother, and the child grew up to become a teenager or adult. If a news comes back to the child that your father passed, for that child, is it going to be any relevance? No, because the level of attachment, the interpretation of the loss, as compared to the next scenario, a parent who gave birth to their children, took care of the children, provided everything for the child from childhood to adult stage. If that child lost that parent, you will realize that the process of recovery, that child is going to spend a longer time recovering as compared to the child, father who did not respond to the child. So just to answer directly to your questions, there are a lot of mental health issues that we still experience. But like I said, there's a need that we have collective action. There are a lot of issues from the 14 years of civil conflict that is unattended to. There are a lot of issues resulting from the recent COVID-19, even the Ebola disease. So these are all of the different issues that we need to respond to. And this is why we are here as a team comprising of Carter Center and other institutions to raise the awareness so that we all prioritize mental health issue and provide the necessary services for recovery. Thank you so much.
All right, thank you ever so much. Let us come back to Mr. Bada. Mr. Bada, you've been through this role of mental health. Can you just tell us what was the biggest myth you ever heard around mental health support?
What I can say, the myth around mental health is that people with mental health condition or psychosocial disability, that they encounter this problem because of witchcraft. For some of us,
especially in Liberia,
they said because of witchcraft or some or actions that he did maybe during the war that were affecting him, some wickedness and all of that. No, mental health is like any other illness, I can tell anybody. So it should be treated as equal as the AIDS you have, as a TB and all of that. Because you have medication for AIDS, which is free. You have medication for tuberculosis, all those things are free. And you can even find it, but not with mental health, psychosocial or medications.
So our problems come back to our lack of education.
Lack of education in this country. People, so we need to create, like my brother Thomas said, we need to create more awareness.
Sure.
There are people that don't know anything, that because people believe that people with mental illness or mental health problems are those in the street, roaming around in the street. No. Someone may be dressed up, sitting at Capitol building, but they have mental health issues, but you don't know. So this is why we need to make mental health a global priority.
All right, now just hold you there and move to Mission Soiree quickly, representing the Carter Center on this theme. What are some of the activities marking the observance of this year World Mental Health Day in Liberia?
All right, so thank you. Like I said, Carter Center, we're working with other partners, other civil society organizations, the government. And today, we're going to be celebrating the World Mental Health Day on the 10th. We're going to be starting from the 1st of October. So the first activity we're going to start with is this. The Carter Center have worked with youth, some youth groups. We work with the Young Ambassadors of Mental Health, other mental health organizations that have come together. They've put all their youth together, and we train them on what mental health is. We train them as peer educators in schools, in the communities, to identify mental health cases and make referral. Those youth groups will be gathering on the 1st of October to do a 1K walk So we're walking from Musu Spat all the way to the SKD Sports Complex, where we'll be doing the wire dance, which is which has gone viral. Everybody is interested in looking at wire. So we're not going to be
the more fun of the day.
The more fun of the day. So we're going to be doing our wire for mental health.
Sure.
So from the 1st to the 10th, you have organizations gathering in different places, organizing activities.
And they're going to be unified.
Yes, we're going to be unified. So on the first day, we'll have free t-shirts that have been contributed by other partners, Action Against Hunger, MSF, Ministry of Health. A lot of institutions, we came together, we put together over 1,000 t-shirts that we want to distribute to the public who will join us in this work. So we're inviting everybody to be part of that first day activity. The next activity we have from the Carter Center, we will be doing the launch of the Mental Health Champions at the Moravia Center, Moravia City Hall. So on the 5th of October, we'll be launching Mental Health Champions. These champions are people who will be helping us to raise awareness on mental health. They will raise funds to support mental health projects. They are influential people. They work with different institutions. We have Brenda Moore. She worked for KEEP Liberia. We have former mayors. There are a lot of people in that champion that are going to be launching this program on the 5th. We have the school mental health programs. We'll be in schools, in the 7 school-based clinics that we have with Carter Center, raising awareness on mental health. We're going to be doing a survey to see the impact of our work that we've been carrying on for the past 5-6 years in the school-based clinic. What impact have we made? And then we'll raise more awareness when we look at the gap to see what we can do for the next step. We'll be also launching the financing studies, how to finance mental health projects. So on the 10th, we're also planning to do a launch of the financing
October 10
of the financing studies for our mental health programs. So these are all things.
And that will be the final day.
It will be a final day on the 10th. But these are just part of what I've said from the Carter Center perspective. Other institutions are also celebrating in their own way. They have different programs. So Carter Center is open as we celebrate from the 1st to the 10th. But our offices are open to provide human resource in terms of training for mental health. We also provide trainings for safe working space, safe space at the work site, safe mental health. We want you to have sound mind as you work, sound mind as you learn. So we have that resources at the Carter Center.
So I just want to ask you a quick question. In Liberia, under the government, we have one mental health facility, which is the ES Grant, mental health hospital or clinic. Are they part of all of this awareness?
Yes, they are. They're even part of the advocacy committee that we have. So they'll also be joining us. When you see the wire dance, I think we have GCH, let's say community health volunteers who also be doing their own wire dance.
Okay.
They're in the community raising awareness. They work with the Grant Hospital. We have the cultivator for Users Hope that is also accessing assistance from you got assistance from the ES Grant in terms of drug supply and referral. So they're also part of this what mental health
You talk about school-based program. Are we just going to focus on from elementary to junior high, or we're going to focus on secondary?
So presently we want to do, in fact, from elementary, let's say from kindergarten all the way to university.
Oh, okay.
We have had trainings that have included all of these institutions, but mainly our school-based clinics are in 2 counties, Monserrado and Margibi. And we have it in 7 schools. The KRTTI, Lago Lepe, RS Coffee in Spenotes. We have Tottenham High School on the 12th Street, BWP, LMA, the Library Marketing is at daycare, ECD program. And then the another school we have is BWP, I already called BWP.
Yeah.
Okay.
So with funding available, are you guys waiting to expand this program in other schools?
Again, I always say to my partners, especially from the Ministry of Education, that these actions are adaptive actions. Adaptive in that you see what we do and replicate into other counties, into other schools. Carter Center will not do all. So we only do the adaptive actions for you to be able to adapt. If Carter Center implemented this pilot project and it worked, can we also seek funding that will extend to other schools? But yes, with fundings available, we are prepared to spread to other counties and to other schools. But that's why we're working with line ministries, the Ministry of Health, the Ministry of Education, Justice, Gender, so that they can then launching these financing studies, launching the mental health champions. They will all help to raise funds to spread this program, because this program is surely making great impact in schools. Initially in our schools before these projects, when students misbehave or they have disorderly behavior or conduct, they just punish them, humiliate them more, kneel down in front of the class, sometimes whip them. But we say no, there's another thing. We have the clinic. It's not only for medical assistance.
I remember I think 2 or 3 years back in Liberia, a
Yes.
student shot his friends on campus.
Okay, good. So we are there to make sure that there are counselors in schools. As a result of that, or maybe in addition to that, the Ministry of Education have trained 200 career guiding counselors, of which I'm one of the master trainers. We train them and we put them in schools to do counseling for our students, to provide a safe space for learning. So with
Thank you.
funding available, it can be
You
spread.
guys ready to spread
Yeah.
all over the counties.
Yeah.
Thank you ever so much. So let us come back to Mr. Yanka. Mr. Yanka, some of the recommendation that the steering committee made was the 1K walk on the 1st of October. Why is that necessary, especially for a person with mental health disorder?
Yeah, well, I'm always interested in collective action. The 1K walk for me is just a medium through which we try to increase our awareness, because we are using different channels, we are using different medium
Yeah.
to raising the awareness, and implementing single-handedly does not give you more result. So once you have collective action, joint action, you realize more result. That's why even in advocacy, you see a single person cannot do advocacy, because you wouldn't have a quick and the desired result. But if you have a group of people or organizations coming together, it gives more magnitude. So this is why we
So
have.
as a suicidal person or a depression patient, why make this day relevant for them, especially when you're talking about 1K walk from Muslim Sport to SKD? Why is that necessary for them?
Yeah, well, because like you said, I mean, just explaining a story, participating in the program is a form of relief.
Sure.
Because for us, we encourage people with these experiences to express. Because one way to observe or complete recovery is to express.
Of course.
Sometimes people even do believe that crying is not part of the healing process, but we also do believe that crying is part of the healing process, right? Yeah, and then we also want the government and other partners to draw attention so that they know that we have people of this nature in our country and are experiencing these challenges. So those are some of the reasons why we will be doing the 1K walk, and we'll be doing it collectively.
It will also serve as relief for them
Exactly.
also.
Yeah,
Because
relief.
especially when it comes to the wire dance, like everybody having fun, laughing,
Yeah, sure.
joking. Okay, thank you all so much, guys. Time is fast. Time is our greatest enemy in studio. Also our best friend as well. We almost out of time, just less than 10 minutes in studio. Now go back to Mr. Bala. Mr. Bala, what advice do you have for the public, especially those that are listening to you when it comes to mental health awareness and well-being in Liberia?
All right. For me, I would say caregivers. That means the parents, father or mother, caregivers are very important, even your brother or your sister. So I'm speaking directly to caregivers so that you have to help your loved one, your brother or your sister, your son or your daughter.
Okay.
I'm here today because my mother gave up and my grandmother gave up, but my brother didn't give up on me. So he kept on taking me to places. We were in a church, and then the pastor advised that, oh my man, I think they got a place to Dupo Road there. So
ES
we went
Green.
ES Green. At that time, there was a German organization taking care, they called Cap Animal. So he went there, and they just took me there. So I became stabilized and got discharged and continued my education at the university, and then I graduated in 2012. So caregivers are very important. So people, let me tell you, people will not just be in the street. People you see in the street, you call them quote unquote crazy people. They have families, they have sisters, they have brothers. So you need to stand
They
with
didn't make
them.
a choice.
Yeah,
to
they didn't
be
make it to
there.
be in the street, so you have to be there for them.
Sure.
So that's my little advice. You have to be there. You have to care for them. As big as I am, my brother still care for me. In fact, I'm accessing medication to one of the MSF facilities in Pipeline, the Pipeline Health Center. So at times, if I due for my medication maybe October 1st, and I'm not going there on October 1st, my brother will receive a call, or I will receive a call reminding me of my day to go for refill.
Okay.
So that's a caregiver. So it's good, and he will call me directly. Then the people call me from MSF. You need to go for your medication. So those are some of the roles you provide to help the person not to be in the street.
Indeed, caregivers are very essential when it comes to mental health and well-being, because the way you talk to people, you will also help them, and the way you talk to people, you will also hurt them. So we have to be careful with the words we use, especially when it comes to this mental health, this other mental health condition in Liberia. Mr. Suarez, is there any other thing you wanted to tell the public? Just those 2 minutes, please.
All right. So
Is there any
we,
other thing I'm going to talk about and you would like to tell the public?
so to the general public, we are raising this awareness on mental health. We want to make sure that all of the country are members of citizens of Liberia are mentally healthy, to be able to exhibit their full potential in terms of producing for Liberia economy, making sure that at the workplaces we have sound mind in doing our work. In doing our work, we also want the government to please help us, although they are doing their best by working with partners in terms of the implementation of the mental health policy. Like I keep stressing on it, that's one of the major instruments that is now under review, that we all need to put our hands in. As much as we have the law, we have the policy, we are asking them to help us with the full implementation of this policy, and asking all partners to have hand on to make sure that mental health is prioritizing Liberia.
Okay, thank you so much. Since you are the only beautiful ladies on this team, I think we give you that privilege to at least you should be the first to give your closing statement and your advice for the public.
All right, so to the public, our brother Ben has rightly said it. We want you to please support persons with mental illnesses. Make sure your children have the optimal space to learn. Support them. Hug a child. Hug your girl child, support them. When they have issues, pay attention to them. In Liberia, when you have a bereaved family, they go to only attend to the older ones. They forget about the children. Children too can grieve. So we have grief, we have depression, we have anxiety. All of those things should be given attention by parents, caregivers, and our entire government as a whole. So quickly, I want to say, all Liberians, please let us prioritize mental health in terms of our finances, our behavior, doing away with stigma, and the rest of it. Thank you.
All right, thank you so much. So, Mr. Bala, your closing statement, please.
For me, I just want to call on the government of Liberia to prioritize mental health, to support partners as they have been doing before, they are still doing. They need to support partners. These partners will go before, so they will go one day. Carasona will go, MSF will go, and other people will go, but Liberia will remain. So government need to prioritize their own business. We need medication in our 15 counties, 16 counties. We need medication all over. Morovia is not Liberia. Or Mosorado is not only Liberia. We have medication in Mosorado. We don't have medication in Maryland, Grand Jude, and other places. That's not a good sign for prioritizing mental health. Thank you.
Thank you so much. So now I'll come back to Mr. Yanko. Just close everything that your colleagues have been saying.
So, okay.
Along with your closing statement, please. 1 minute.
Thank you so much. I just want to make a reference to $1 million question that keep coming. Every time we do implementation, we provide humanitarian services, we do trainings, we create awareness, mental health awareness. We are taking 10 days from the 1st to the 10th, and with continued effort to creating awareness. But the $1 million question is, and so what? What next? So, let not our effort all the years, different celebrations, different awareness raising, and then at the close of the day, we cannot yield result. So the question is, what next? And so what is very important. So we are calling on all of the different actors, all of the communities, individuals, to prioritize mental health and see it as a very important issue affecting our country, so that we all can drive attention to helping our community recover from traumatic experiences. Thank you so much.
Thank you ever so much. Well, folks, this is how we come to the conclusion of today's edition of Health Talk. We'd like to say thank you to our studio guests for carrying us through this smooth drive on World Mental Health Day program in Liberia. Thank you so much for educating the public about the show. Mr. Bala, the General Secretary of Cultivations for Ushers Hope. Thank you so much for being on the show today. Mr. Yanko, Program Manager at Action Against Hunger Liberia. Thank you ever so much for being on the show. Mistress Leona Carlos Soare, we'd like to say thank you so much for being here representing Qatar, our institution. Welcome to Mental Health Awareness Day in Liberia. We'd like to say thank you so much. This is how we come to the end of today's show on the Mama Lume Health Talk platform, and please do join us next week, Thursday, same time, same studio, on another fascinating topic on Health Talk. Please do not forget to follow our Facebook page, Mama Lume Health Talk platform, and YouTube channel, Mama Lume Health Talk platform. Keep all of your comments coming in. If you have the time, we'll read them live and interact with you on our Facebook page. This show is proudly sponsored by Honorable DJ Blue. We'd like to say thank you, Honorable, for allotting us time in studio to always discuss health issues that are affecting our people in their respective community. Let me leave you with this when it comes to mental health. Mental health is not about the absence of mental illness. When we take the time to ask ourselves and others about the mental status, we can potentially make some crucial steps towards well-being. We can think of our mental health as a commune, with languaging at one end and flourishing at the other end, by starting a dialogue and showing that we care. We can help each other and get the help we need potentially begins with us. Oh, it helps to get us the support and the acknowledgement we need that it is okay not to be okay, because you are definitely not alone. My name is Momoa Elume, a registered nurse. Please do take care of yourself and have a wonderful, wonderful day. Thank you.
Bye.